Investigation of automobile accidents. Investigation of automobile accident should include examination of accident scene, examination of involved vehicles, a complete autopsy of all dead victims, study of patterns of injuries, physical examination of both the dead and surviving drivers, and psychiatric examination of surviving drivers. Person and social histories of surviving person, examination of scene. Note a photograph and location of each vehicle, condition of road, type and surface of road, whether the road was wet, slippery, undergoing construction, dirt track or well constructed, whether contained potholes which would have destabilized vehicle, presence of distracting features, example advertisement shops, malls, bars, etc. around the scene, victims, their location and position on the road, their distance and direction from the site of the impact, blood and the size, direction of blood patterns on the vehicle's road and on victim themselves, traces left by vehicle, dirt from under surfaces of vehicle. As vehicle drives over different terrain to collect dirt on under the surface peculiar to those terrain, it is sometimes possible to identify the vehicle from such dust. If before accident the offending vehicle had been striking other objects, dirt may have fallen off the undersurface and it would be a clinging evidence as to which the vehicle was violating traffic rules. Paint. Flakes of paint from the vehicle may be found on the ground or on victim person or animal or object hit by it. Conversely, traces of blood, flesh or object may be seen on a vehicle. Locard exchange principle. The skid mark causes rubber being deposited on the road, much like that of an eraser leaving pieces of rubber on a paper. Types. Acceleration type created on acceleration. If the engine provides more power than the tire may transmit. Deceleration types, there are braking marks when the brakes lock up and that causes the tire to slide. Yaw marks when the tire slides sideways. Car turning a tight corner, each has a characteristic appearance. An experienced forensic scientist can determine what the vehicle was doing by examination. These marks should be measured, sketched and photographed. Specific type indicates application of brakes and or accelerator, important for reconstruction of an accident, for cross-checking statement by drivers and witness. Tire marks causes 3D indentation made by the vehicle when it is traveling on a soft surface, example dirt, mud, snow, wet, cold tar, while tire marks show tire thread pattern, skid pattern marks are fearless. Photography. Tire marks should be photographed as the patterns can help in the identification of vehicle. The pattern contains class characteristic which can identify the manufacturer and individual characteristic. Cut made by glass, nails, sharp stones, specific wear and tear of the tire which can identify the individual vehicle. Tire mark cast. A cast made must be prepared by pouring suitable material and letting it set. Their cast may be compared with the suspect vehicle. Traces left by victim. Blood, cloth fragments, hair, tissue fragments, sketch their extract location, preserve and send to laboratory for examination. And examination of the involved vehicle. Complete mechanical and engineering examination of involved vehicle and of each component whose failure could have led to the accident is done. Photography. Exterior. Involved vehicles are photographed from various angles to record the type and extent of damage, indeed especially areas of deformation and impact point. Bend knob, broken windshield, door, instrument panel, steering wheel, amount of deformation. Determined by measuring the various dimensions of vehicle. This can give the speed of the vehicle since amount of deformation directly proportional to combined speed of the vehicle. Collection of evidentiary items, human tissues, blood, hair, torn piece of clothing entangled in projecting part of fibers, split oil and petrol, alcohol bottle, drugs of abuse in the glove compartment, trunk or other part of the car. treatment papers in the car point B to diseases of drivers. C. Especially the under surface of chassis for blood, torn clothing pieces, fibers, hair, and tissues as a victim might have been overrun. This trace evidence can be matched with the victim and his clothes to identify offending vehicle. Autopsy. Objectives are caused to determine what caused the accident. Example, drug and alcohol intake of the driver, fault of the vehicle, faulty road condition, reconstruction of the accident. Reconsider the position of the victim prior to the accident, identification of victim if mutilated beyond recognition, cause of death, manner of death, to differentiate injuries caused by being hit from those caused by being run over, to identify the driver of involved vehicle, especially when bodies have been ejected out, to identify the offending vehicle in hit and run cases, to determine the significance of the previous injuries. Clothes. Examination should be done while clothes are still on the body. This can indicate the part of the vehicle that struck the victim, not direct roads, dust, etc. Glass pieces from broken lamps, windscreen, etc. Grease and oil mark, metal piece and paint and smudge mark and tire imprint all over the clothes and torn areas. Identification of drivers. Drivers is identified by brake or accelerator pedal design is imprinted on the driver's shoe sole. Finding of driver's license on the pocket especially useful if no other body shows a similar license. Finding of the paint or glass from the door on the driver's side of the victim's body and health. Cloth. Matching the cloth fibers, hair, blood and tissue from the body with similar items recovered from the driver panel. Doors or glass on the driver's side on the steering wheel and column. Presence of the steering wheel impact and type of injury. Body. Eyes, corneal or lens opacities, ears, tympanic membrane, ossicles, not integrity. If victim could not see or hear properly, claim of contributory negligence is possible. Lungs, post-traumatic pulmonary pseudocyst, blood group, DNA profile of victim match with that found on suspect vehicle. Cause of death. Cause of death, driver, it should be determined if he died due to a natural death cause myocardial infarction. Then lost balance of the vehicle. Whether he died primarily due to injuries sustained during the accident. Pedestrian, same determination as above. Whether suffered an attack of unconsciousness etc. and fell before the vehicle, in which case there is no liability on driver. Died purely due to negligence of driver. Injuries that may be missed. Vehicular accident may cause following injuries which may be missed. Fracture and hemorrhage in the atlanto-occipital joint, contusion and laceration upper cervical cord, extensive muscular hemorrhages, extradural or subdural spinal cord hemorrhages, toxicosis. Car exhaust gas may sweep into the vehicle and cause of death. Examination of survivors. Physical and psychiatric examination. Diseases. Following disease may be precipitated accident by making the driver unconscious or less aware of the surroundings. Endocrine diabetes, who are on insulin may experience hypoglycemic attack accident. Who are on insulin may experience hyperaccident. CNS, cognitive impairment, Alzheimer's disease, epileptic attack, migraine, headache, stroke, CVS, coronary artery disease, commonest disease as a cause of vehicular accident. In some cases, a person suffering from MI while driving is able to slow down or stop vehicle in time to avoid collision. Valvular heart diseases, muscular skeletal, reduced mobility in pedestrian. Eye color, blindness, vision, defective hearing, general physical fatigue, mental and psychological fatigue. Driver falls asleep while driving could be due to inadequate sleep during night due to number of reasons, obstructive sleep apnea. Some countries, the driver must get a certificate stating that he has no OSA. Determining the contributory role of disease and trauma and death. Assess the severity of the injuries. If they are not sufficient to cause death, natural disease must have contributed to death. Example, this precipitating MI, cardiac conduction disorders, drugs and accident. Alcohol, insulin overdose of insulin or even normal dose not associated with sufficient intake of food, serious lack of control over the vehicle, psychoactive and other drugs. Psychology and accidents are more prone in person who are emotionally upset or who are suffer from anxieties. Patients of ADHD display more driving, anger, aggressive expression through the use of their vehicle. Personal and social history, whether drug or an alcohol addict, history of violence, anger, etc. Predilection for fast drive cars and fast driving. Thank you.